My name is Kari-Tate, and I work in gynecology, which is the branch of medicine that deals with the function and diseases of the female reproductive system. I currently work in an on campus clinic with the majority of my patients being female college students. The disease that I will be discussing today is the human papillomavirus, or HPV. This is a sexually transmitted infection, or an STI, that is incredibly prevalent among young females in particular. Over the past year, I've seen this disease occur in 180 out of 200 tested female patients. So, out of all of the female patients that came and got the test done, which is usually done through a pap smear, 90% of them tested positive for the human papillomavirus. In most cases, there aren't any symptoms with the human papillomavirus, which can really be a reason why it is so prevalent and is spread so easily amongst the population, because there aren't any symptoms that would lead someone to go get it checked out or tested. When you treat a patient that has HPV who has been tested positive for it, I recommend the patient receive a colposcopy. This is a procedure that can be done really quickly in your doctor's office. It's mildly invasive. It really allows the gynecologist to closely examine the cervix to make sure that there isn't any cervicitis or inflammation of the cervix. If cervicitis is present, it can be indicative of precancerous cells or a development of cervical cancers such as carcinoma in the situ or CIS. So it is important to get that colposcopy done once that patient has been deemed positive for HPV. In one particular patient whose name has been removed for privacy, she was diagnosed with carcinoma in the situ or CIS after getting a colposcopy done. She was tested positive for HPV when she was 27 years old. She is a white middle-class female with no previous medical issues at all. But she had waited until she was 27 before she received her first pap smear, which allowed the virus to develop from just a sexually transmitted infection into a form of cervical cancer. She was then referred to an oncologist to treat that cervical cancer and go from there. In order to better prevent the spread of HPV, I think as healthcare professionals and especially professionals within gynecology have a responsibility to spread education on the HPV vaccine. That is 3 different shots that you can get as soon as you are around 12 or 13 years old before you become sexually active. It will protect you against many forms of the human papillomavirus, but it doesn't protect you against every strand of HPV. But it is also important to spread the education and importance of getting pap smears done as soon as you can and getting them done yearly. Also being tested for other sexually transmitted infections every 6 months to a year to make sure those don't develop into anything more serious. Also spreading information on the importance of practicing safe sex and how to do so. It's essential for healthcare providers that are dealing with this disease to understand the importance of checking in on it every single year through pap smears, just to make sure that it's not progressing into precancerous cells and then into cervical cancer. It will allow that to be caught early if there is signs of cervical cancer, which can better help the chances of them having it treated and not being life-threatening. A major problem that still needs to be solved within this disease not only is just the spread of the information about it, but also the vaccine doesn't yet protect females against every strain of HPV. So it is important for us to continue working towards having a more protective vaccine.